So I'd like to introduce to you the Hyperthermia, which is Health Canada approved device that we use here at our cancer treatment center in Winnipeg. Any tumor that is in the body at whatever depth can be treated using the Hyperthermia. The basic idea here is to create a fever temperature in any tumor site. At fever temperatures, the cancer does not do well. The surface proteins break down, the cancer can be knocked down as far as its volume goes, and as well as it tends to stimulate the immune system. So the immune system can come in, recognize that there are tumors there now, and actually the body does the work that it needs to do on these. Patient would lie in here for about an hour for treatment. For brain cancers, it's a shorter duration, but the treatment takes an hour, and patients basically lie, and there's no side effects that patients experience from this, which is nice. The Hyperthermia is usually used in conjunction with an anti-cancer medicine. So whether what we use here in the clinic is, for instance, IV vitamin C, or we use IV poly-MVA or ALA, these kinds of anti-cancer medicines can be used at the same time, and this gives added effect to it. So the probe is put over, for instance, over the abdomen or over the chest, and is placed local. So it's called local-regional hyperthermia. These units cannot be replaced by a simple radiant heat. Radiant heat will only get, for instance, sitting in front of the fireplace or sitting in front of any heat source, will not get deep enough in order to treat a cancer because the skin tends to absorb that radiation. And here it's a radio frequency that's produced, so it's basically an electrical current that gets to the tumor site. The machine has the ability to heat tumors at a deep level, and this is sort of the magic of how this works. There's a lot of research on the Hyperthermia, and it's a little known alternative cancer treatment that should be better known just by virtue of how well it works. What it does is it has a few actions. The most important action that it has is that it tends to heat tumors to a fever temperature, which any tumor in the body at any place doesn't do well in, because it breaks up the surface of the tumor. So there's tumor destruction that happens as a result of the treatments, as well as immune recognition. That means that the immune system is the governess of taking care of any tumors that are growing anywhere. They tend to destroy tumors and take care of them before they become tumors. So the idea of this is to get the immune system stimulated, to kill off cancer cells, as well as to create an environment of getting medicine to the tumor site itself, which when chemotherapy or radiation is given, it tends to go everywhere, especially with chemotherapy. That's why there's hair loss, or that's why there is gastrointestinal upset, that's why there's numbness and tingling in the fingers and the hands. It's because the chemotherapy is given but doesn't focus in on the tumor area. The studies show that with this, it tends to create circulation to an active tumor and bring the anti-cancer medicines, including the ones that I mentioned, as well as the anti-cancer medicines that we use here at the clinic, vitamin C, poly-MVA, alpha-lipoic acid. All of these natural anti-cancer medicines also can be brought to the tumor site nicely by this. So patients would lie down, and they would have the probe placed on top of them as well. The bottom has probes that have a transference of the radio frequencies from the top to the bottom. So if it's a brain that we're treating, or if it's a lung, in the studies we see that it creates the environment to handle tumors wherever they may be in the body. But it actually allows for transference from the probe on top to the tumor site without heat being generated on the skin. So the effect is local regional hyperthermia. It tends to heat the tumors wherever this might be placed. So the Hyperthermia, as strong a device it is, there's not a lot here in North America. However, there are very many. There's 300, 400 devices in Germany itself and across Europe because of the training mostly of oncologists in Europe. And in Germany specifically, every oncologist that is trained in medicine is also trained in alternative medicine as well. So this comes high on their list of things to use for cancer treatment. We brought it into North America so that we didn't have to have patients traveling all the way to Europe or to Mexico to have these treatments done, but they can be done right in the backyard at their own convenience with family and without the cost of travel, and also without the cost of the expense of going to these faraway places. So we're proud to have this here. It's a very effective treatment. We enjoy our responses that we get and the patients that come in for their treatments. As well, patients now can come in for the treatments for fibromyalgia as well as using it for Lyme disease, as it tends to also hit bacteria that causes Lyme disease and heat them to the fever temperatures that we see heated in the tumors. So there's also another purpose for the hyperthermia. What we've got here on this side is the computer that runs the hyperthermia. It has an interesting component to it that will show you. You can see here that the temperature here is 36.8. What we get to in the treatments using this machine is up to 42 and higher. 43, 44, 45, 46 sometimes is what it gets up to, are the temperatures that we are required to help that breakdown of the tumor and its effect on reducing tumor burden, for instance, and increasing the immune system to help to fight against any tumor growth. Okay, and so that's the information on the hyperthermia. Thank you very much for listening, and we would like to hear from you. So give us a contact either through the email that's on site or through the phone, and we'd be happy to answer any questions you might have, or see you here at the clinic and go through your scenario, what's happening for you with your cancer or a loved one's cancer, and then we can go through and explain all of our treatments that we do here in Winnipeg.